This is my 10th grade biology project. I chose the disease whooping cough. Now, to answer the first question, whooping cough is caused by a bacteria called Bordetella pertussis. This specific kind of bacteria infects the pharynx, which is the upper part of your throat. Now, this kind of disease has pretty harsh symptoms. Some of the symptoms start off cold-like with runny noses, mild cough, watery eyes, and maybe a little fever. But then once those symptoms go away, you're left with this really bad cough that you really cannot control. And what happens a lot of times is you have these coughing fits where you cough so long that you can't breathe. And when you do breathe, you're taking in air, but you're making this like whooping noise. And thus, that's where they get the name, whooping cough. And what can happen is the coughing is so intense that a lot of times it will induce vomiting and tiredness. On the bright side, the disease can be treated. Since it's a bacterial infection, it can be treated with antibiotics. There's obviously the vaccine for it, but the vaccination is more so to help prevent whooping cough. But in the case that you do get whooping cough, like I said, it can be treated with antibiotics. Now, for a little history about whooping cough, two French scientists, Jules Bordet and Octave Jangu, are credited with the discovery of this bacteria, Bordetella pertussis, and finding out that that is what causes the whooping cough. They were bacteriologists, and that means that their special skill was like studying bacteria and things like that. They discovered whooping cough in 1906. They also are credited with finding a cure for it, or the vaccination for whooping cough. So they get the credit for discovering that in 1906. The main cause for discovery was that it was becoming extremely common. Outbreaks of whooping cough began back in like the 16th century, but nobody knew what was causing it until 1906, so it was a really long time. But because they didn't really know what caused it and they had no way to treat it, there were over 250,000 cases of whooping cough per year in the U.S., and it was a lot more harmful back then and would cause many deaths, up to about 9,000 per year, because they had no way to treat it. And so it was a lot more harmful and deadly back then. And so the main cause for discovering it was trying to find a way, to treat this disease so that less people would die from it. The disease is a pretty common one. Yes, many people end up getting whooping cough. Even though they do have the vaccine does help people that have immunization to it. Some people still end up getting it anyway because you can't prevent everything from happening. The most common places that people tend to get whooping cough are in places, with like a lot of people. So daycares, schools, workplaces, things like that, where you can't really control what people are touching. And so you're at a lot greater risk of getting the disease, because the disease, whooping cough, can be passed on really, really easily. If somebody has it and they cough, well, they're coughing out the germs and the bacteria, and even if they, let's say, cover their mouth or something like that, well, then if they touch something and then you go back and touch it, well, right there, now you've got the germ and the bacteria. And so when it people get it, and when there's an outbreak of it, it's really contagious and really easy to be passed on. So essentially, anyone is basically at risk of getting it, but the people who are at most risk are infants under a year, because it can be really, really deadly and harmful for them, and is extremely dangerous for kids that young to get it. But obviously, we're all at risk of getting it, but it's a lot worse for infants. It's definitely not a fun thing to have. In some cases, it can even lead to other sicknesses like pneumonia or bronchitis. So it's definitely something you want to try to avoid. And as we all know, the best way to avoid getting any kind of sickness is to always wash your hands.